those ecological sort of services. I'm hearing more and more about health insurance companies in the States starting to pay attention to this and looking at how they might become involved with nature planning, nature policy in cities in order to enable health. School districts, workplace, more and more companies are thinking about how to enable their people to have contact with nature or how to install gardens and spaces in the workplace. So if we start to connect these dots with other partners, other opportunities, other collaborators, the health messages give us the background in order to develop those messages. And as part of this, thinking about trees as placemakers. And again, we're learning more and more about the nuance of how people respond to trees, canopy, and health. And just as we think about traditional forests as an ecosystem that has structure of multiple vegetation layers and multiple functions and biodiversity within that space, perhaps then we can think about urban forest spaces in a similar way. Not literally that they're ecologically biodiverse, but that they provide a diversity of function. So the place on the top there, perhaps being a place of quiet and contemplation and reflection, where the lower left is more a place of commerce and more economic activity perhaps, but also recognizing complete streets and possible traffic safety benefits provided by plants. And finally, on the far right, just fun places where people like to be. And because they can people watch, they can hang out, they can find goods and services, the canopy creates this space that welcomes all of these different activities. So back on track. Cradle to grave, obesity, overweight, condition of being overweight, a lot of attention to this in the States as well as other nations. And it's become an issue that rather than looking at it as a medication, a prescription, a necessity to provide meds for people, this idea of activity within outdoor space is gaining more acceptance, more prominence. There are doctors now in some cities in the States that are actually doing parks prescriptions. They are seeing patients, and as a first step, a first activity, or a first attempt to help people bring their weight down to normal conditions, they're literally writing out, go to the park, certain amount of time each week, certain number of times each week, and be active. Go out and be in the right places for this. So there's this collaboration developing between medical systems and park systems to make sure that the parks are safe, adequate, and provide the opportunity space that enable this sort of thing to happen. This is not the solution for the activity. You really need to get out of the car, get out of the box, and move about for a variety of reasons. Playing out into the elder years, now moving towards the right end of that spectrum, older age. Not quite at the grave, but starting to get toward that time in life. And a study that was done in Japan, finding that elders within walkable communities, some of them having more green, some of them having very little green in the Tokyo area, and here you can see less illness, lower mortality rate over 5 years. Again, do we know why? Not necessarily. Here's another relationship. But it's a relationship that keeps appearing time and time again in different types of studies, different sorts of contexts, to the point where now studies about the why, the causal connection, are becoming ever more important. Walkability. We create good streets for walking, we create communities for walking, and we see other mental health benefits, other mental health values. And this idea of meditation So here, the EEG in the title is yeah, that's it. Brain waves, right? So looking at the brain waves, doing telemetry, some of you who have done biological or ecological studies, you're probably aware that collars and things can be attached to animals, and then the telemetry, you can figure out where they go and what their patterns are. Well, some of the people who are studying health are doing human telemetry, and they're attaching devices to people, Fitbits at the very least, and accelerometers, and in this case, a mobile EEG, so that you can do real-time, live-time recordings of how people are responding. And in this instance, they found this condition of higher meditation. It's in your brain waves. Now, why is that valuable? Why is that important? Because we're ever more finding that people are so busy that to take time to think through what's happening in life, what are your goals, what are your priorities, how do you get things done. Mindfulness, meditation is an important activity, an important need in our everyday life. And here we see another study, a series of studies looking at depression in relationship to activity. And we see that, again, there's this connection, exercise recommended, people who are becoming more willing and motivated to do the recommended activity if there is access to nature in doing so. This is a study that I just was told about, a series of studies actually. And it's intriguing to me. I don't know that I quite buy in yet. I have to read more, understand this a little bit more. But there are some scientists within the field of neuroscience that are discovering that what happens down here in the gut is connected with what happens up here in the head. And they're finding that it might be some sort of microflora. So the composition of the critters in our gut and the substances that they release, in addition to how they manage our food digestion, appear to have some connection to our mental condition and our mental state. So one person, Dr. Lowry, has been writing about the hygiene hypothesis. And as part of this, he is suggesting that children are growing up in far too sterile environments. The children are not having the contact with soil that, if you will, inoculates this gut microflora. All right, so this is a very kind of preliminary idea to my understanding. I've not done a lot of reading about it, but I find it intriguing that activity in nature, not just seeing it out the window, but activity, planting trees, planting plants, and that occasional transfer to the mouth, kids eat dirt sometimes, that it might have really important consequence for other functions in our lives. Here's a classic, one of the first, Roger Ulrich, way back in the 1980s, and you've probably all heard about this. Surgery, it was a natural experiment. He had access to patients' records, and the patients were undergoing gallbladder surgery, and some were randomly assigned by the hospital to rooms with windows having a view of bricks, others to rooms having a view of trees. And there you see the outcomes. As I said, it's a classic. Roger is now retired, living in Sweden, but I don't think, he's retired in principle. I don't know that he's retired in activity. He's still continuing to do research. Hospitals, so Roger, colleagues, students, and of course other investigators interested in this role of nature in the hospital, in the healing environment, have continued to do studies. And the healthcare industry is now accepting this and introducing design spaces, healing spaces into hospitals. And they're finding that there can be healthcare savings if people are using less powerful analgesics, if they're leaving the hospital sooner. But they're also finding that it's a marketing opportunity, because if people are in nature and they have a great experience in this hospital because of good views out the window, because of a positive sense of well-being with views of nature, that they're willing to come back or to bring loved ones to this hospital in the future. So it's become this odd sort of marketing opportunity. And so some hospitals are retrofitting green spaces, quote unquote green spaces, that patch of lawn on the left. That is the same space on the right. And if you look closely, there again, the texture, the variety of spaces, the variety of plant materials are in part what enhance or bring that healing dimension to that space. Some really key features there: very wide walkways so that people can walk side by side with a caregiver, or they can move through the space with a wheelchair. Visual features that mark different locations within that garden. Places where you can be quiet with someone you love or your caregiver. So there are places where there is privacy within this. Some of the subspaces are quite public, others are private. And different visual features. So there might be water, soothing for people, art of an appropriate type for healing environments, but we see the richness of what we can create, with trees being the scaffolding, trees being the overall structural element, and within which this detailing can happen. Here's another example. This is from a burn treatment facility, a garden within that in a hospital in Portland, Oregon. And here again, recognizing the particular needs of those patients. For instance, water fountain, the soothing noise of water outdoors. Burn patients, skin is healing, it's very sensitive to the sun. So there are opportunities for both sun and shade, very distinct locations within the garden. And then you see the general mix of textures, landscape style, or landscape design of value to people. Another thing that hospitals are finding, and studies are now underway, finding that staff are in very high demand positions, and their fatigue and their attention restoration needs are important as well. So hospitals are now creating intentional spaces for staff as well as for patients and their loved ones. Moving along, getting towards the end of this. Mark's just about ready to give me the 5-minute mark, I believe. And as we get older, we're maybe a little less mobile, and yet that connection to nature, that tangible connection to nature, continues to be important. Here's one example: horticulture therapy in an elder care facility. And by moving, being in this social, coming together with other people and with the horticulture therapists, and the combination of these social connections and movement, ongoing physical movement, is very important. Those are two factors that contribute to sustained good health when we're elderly. Is social connections. Again, if we're lonely, if we're isolated, if we don't have people looking in on us, if we don't have people that we can count on to assist us, when we need aid or when we need to talk, contributes to poor health. And mobility, if we're not able to move about, if we don't maintain muscle tone and muscle capacity, a fall can be a really serious start to a road down to worse health or to unsatisfactory health. So nature can be used. Nature activity, involvement of elders in tree plantings, involvement of them in forest activities as well as horticulture activities, can be a way to enable and encourage better health. And finally, when the mind goes, it's a horrible thing. But it's happening more and more. The incidence of cognitive disease in older people, dementia, Alzheimer's, In my case, jet lag. Sometimes the right words don't always come to mind. But there is now effort to understand how having certain controlled green spaces in relationship to people with cognitive disorders might be of benefit. And here's a study finding reduction in the amount of medications, having a wander garden, and also reductions in falls. And these places, again, have to be carefully designed so that people can move through them readily. They can orient themselves within these spaces and not get lost. They have to be within view of caregivers that may be within the garden or may be watching them from the building. So thinking through from canopy to space to placemaking for health is the opportunity that we have before us. All right, quick blast through some current work of mine. You may notice there were none of those citations had my name on them. Again, I'm sharing from a collection of people all over the world who are doing this science. But here's something that we're tackling, a team of economists and myself, is to attempt to wrap some economic value. If you recall with iTree, we have structure, function, value, and management. Well, we now know the benefits, the function, and if we can bring some of the value aspects to that, we could start to maybe work towards an iTree health or an iTree wellness sort of idea. So to do valuation, we need to understand what are the benefits, who gains those benefits, to identify the population of people, and that may be place-based, it may be associated with certain land uses. What is the green condition? What is the degree of presence of trees or gardens or horticulture that provides this benefit? Then the question of scale, how many people, where? Is it a nation? Is it a neighborhood? Can we determine that? And then what are the costs? Finally, what is that value element, that economic element? So we've been scanning these articles that we've prepared for the database, the article database for Green Cities Good Health, and we've tried to find the best prospects from existing literature, from existing science to do this valuation. And here you see a table. The benefit, and again, it's a life course approach from newborn birth weight to Alzheimer's. The nature component that appears to date that we understand contributes to the benefit, and then what might be the outcome that has economic consequence. Here are some preliminary numbers. Please, again, preliminary, the article is in review. We're still waiting, hoping that it will go to publication. But in the meantime, we have these numbers, and we're working on another article that digs in to understand elders and nature benefits. This is a modest amount of money. I've come to learn that about 20% of the state's gross domestic product is associated with health care and health treatment. Almost 20%. So we're talking trillions of dollars on an annual basis. Where the benefits that we have discovered, the economic value, and this is a small set. There are many other benefits, but the writing of the articles was not helpful enough for us to understand what might be the economic translation. But we're looking at billions of dollars here on an annual basis, a range of billions. This is for the US alone on an annual basis. But it's a beginning to, again, bring this idea, bring this story to people who would not typically think about nature as something that is a part of their institutional and policy response to health in our communities. Again, it's pennies on the dollar with regard to how costs, the overall health costs of our communities and our cities and our nations. But it does represent something that's important, and it represents a value that may be even greater beyond that economic. The sense of wellness, mental and physical health, the value to our caregivers, the value to our loved ones to be in better health, all of this comes into play. So to wrap this up, we have an astounding amount of research now but I find that people aren't quite as aware of this as they are of some of the environmental services because it's distributed across so many disciplines: sociology, landscape architecture, urban planning, geography, anthropology. So Green Cities Good Health was our effort to bring this all together in one place where you might find it of value and useful. A great variety of health benefits. They're available to us from cradle to grave, from first hours to last hours. Disease prevention as well as health promotion, the full scale. And there's economic value embedded in all this. And we're just beginning, not just me, but others who are working on this. We're just beginning to tease out that economic value. And with that, evidence, value, maybe we can find more partners. Maybe we can find more collaborators to take this forward, to build greener cities, and to sustain our urban forests. And I don't know if there's been mention about the availability of the PowerPoints. This presentation will be available if you go to this website, top right link, it says what's new. I will have this slide set available probably tomorrow morning at that link. And all of what I've shared with you is made possible by public money in the States. So plagiarize, take it, use it, communicate as best and as much as you'd like using this information. Thank you so much.
Well, thanks to Kathy for another really excellent presentation. That brings us to the next speaker, Mike Raupp. Mike is professor at the University of Maryland. His research focuses on invasive species and urbanization, and his outreach provides training on IPM, integrated pest management, to arborists, master gardeners, and the general public. He has more than 250 publications and is a regular guest on television and radio. His website, great title this, bugoftheweek.com, has received more than 1 million visits. Mike has a dozen regional and national awards, including the Secretary of State's Award for Environmental Protection, the Entomological Society's Achievement Award in Extension, and the Richard Harris Author Citation from the International Society of Arboriculture. His most recent book, 26 Things That Bug Me, introduces youngsters to the wonders of insects, while managing insects and mites on woody landscape plants is a standard arboricultural text. It gives me great pleasure to introduce Dr. Mike Raupp.
Okay, well, you know, I didn't really do all that stuff, but I find if I put that in a CV that I get invited to wonderful places to give presentations. So thank you very much. Fantastic. And I did want to thank Keith and Barcham's for inviting me over. It's always good to escape the States and come back to our roots over here in Europe. It's delightful. And my hat's off to my wonderful colleagues. The presentations, I think, have just been fantastic today, don't you? Spectacular. So thank you very much. Let's give it up for this gang here, I think. Thank you. Okay, unfortunately, there are two things I have to stress here. Number one, I'm the only thing standing between you and lunch, and that's a very dangerous position to be in. So Mark is going to keep me on time. And I'm going to bring you over to the dark side of the force, unfortunately. We're going to talk about bugs, evil bugs and the bad things they do. Are you ready? Excellent. Well, this is a bit of a roadmap for where we'll go in the next 40 minutes. I want to talk about what I consider to be the most important threats to the sustainability of our urban forests. This is the realm I work in. We'll start right off the jump here with the importation of exotic invasive species. I'll talk about the issue of the substitution of exotic plants for native plants and what that really means, the consequences. We'll talk about the lack of plant and animal biodiversity on a large scale. Climate change I'll touch on. impervious surfaces, water infiltration, some of the features that go along with hardscape, and then we'll kind of wrap up with some of the issues surrounding the anthropogenic inputs, the things we put into the environment that may actually reduce the sustainability of these environments. So, as Kathy said a few minutes ago, you can't ask me questions, but it's fair game to ask you questions. How many think this is the case? By a show of hands, how many think the rate of invasive species is increasing? Excellent. How many think it's declining? Stone him. How many don't know? Well, how many don't care? We all care. Well, you know, I thought I knew the answer to this question until I was asked to give a talk. Again, it was over here in the UK a few years ago. And this is the case. The rate is not changing. The rate has been constant from about 1860. That doesn't mean we're not getting more all the time. It simply is the rate is not changing. Now, why do we see this inflection point right here? What was the magic about the mid-1800s that basically sent it hockey stick, as we say? There we go. It was the iron-hulled ship, right, and the steam engine that allowed intercontinental transport of plant materials in the scope of days rather than weeks or months. It opened up a period of intense exploration and importation of a wide variety of crops from everywhere in the world. So this was really the tipping point right here, and this has not changed. These things came over in waves. Now, I'll give you a bit of a history about United States invasive species. Our first one was the codling moth, and of course, Johnny Appleseed brought that, I think, when he distributed apple trees around the United States. With the sail ships, of course, we had ballast, including earth, stones, things like this. This was an excellent opportunity for beetles to come across. In 1860s, a misguided Frenchman imported the gypsy moth. Thank you. The gypsy moth is how I got my job. They needed a human being to talk to other human beings about the consequences of gypsy moths, so thank you. 1890, we had many of our first scale insects. Then came the aphids. And we had a flush of critters between 1900 and 1940s. Many of our foliage feeders, caterpillars, sawflies, beetles. And now we are in the era of the phloem and wood-boring beetles. This is a major problem because these are egregious pests. Frankly, aphids, I encourage them. They are a factory for beneficial insects that help reduce the serious pests. Caterpillars, sometimes if you look at them cross-eyed, they'll die. But beetles kill trees. Beetles are tough things to deal with. Most of these come with the importation, the shipment of live plants. By far the homopterans, aphids, scale insects, and their kin are by far the most frequently encountered or frequently imported pests that we have back in the States. And insects far outstrip mites, diseases, mollusks, weeds, and so forth. But now, because of this, and what's inside big containers? Small containers, that's correct. And what's inside small containers? Whoops.